Good morning, Lancer Nation. Hi again, this is Matt Scholl with another update, this being number 8 in the COVID pandemic series. Today I was asked to do a brief synopsis of things. It was basically essentially connecting the dots pertaining to this novel coronavirus. Hopefully everybody's keeping well, as staff, faculty, and students have now completed over 1 month of mitigation. This at the swift and timely direction of our University President and Pandemic Committee, and based on medical evidence and at the direction of our political leaders at all levels. And guess what, folks? It's helping. It's making a difference. I would ask you to keep this in mind as one Groundhog Day morphs into the next. Quite understandably, we are met with fluctuating levels of fear, anxiety, frustration, with seemingly no obvious end in sight. Despite this, and as we contemplate this being the new norm, things are looking up. Look, COVID-19 has been on our radar here at the university since around the Christmas break. This given the number of international students and travel implications at that time. You all know the story. With the epicenter in Wuhan, China, that was ultimately placed on lockdown that lasted 76 days in total. Then the domino effect began to unfold, leading us to where we are today. Our understanding of this virus has been and remains in a state of flux, with new data emerging and changing on an hour-to-hour, day-to-day basis. Transmission of this highly contagious virus was initially felt to be animal to animal, subsequently became zoonotic as transmission morphed from animal to human, and ultimately human-to-human transmission. Initially, it was felt to be limited to travel. Now community transmission far outweighs travel spread as long-term care facilities and nursing homes continue to weather the storm. We are now seeing evidence not only of pre-symptomatic transmission, but much more concerning is that of asymptomatic transmission. Spread of non-aerosolized transmission is coming into play. So where are we now and where are we going? Our medical officer of health was quoted on Wednesday as saying, "We are somewhere between okay and good." Cases in our area have been on somewhat of a stabilization, and in fact, since April the 17th, there's been a steady decrease in numbers. This all means that what we are doing is indeed making a difference. It is helping. As I said, mitigation is our only mode of defense, but it works, which means we must keep the pedal down. Also, as things are improving, we can't get lulled into a false sense of well-being or security. We have to remain cautiously optimistic moving forward as lifting of restrictions starts to happen. This will be a slow turning of a dial rather than a flip of a switch, a process that keeps in mind how the virus behaves. Moving forward, we must remain in lockstep over mitigation, social distancing, hand washing, wearing masks where indicated or felt necessary. Now is not the time for complacency. Let's keep the gas pedal down and do our part. Stay well, everyone, and stay safe.